One of the really important things about breast cancer is it often affects women aged between, say, 40 and 60, and those women are almost always someone's wife, someone's mother, someone's daughter.
I think the day of the diagnosis was really quite difficult. The only thing I had at the back of my head was, how am I going to tell my children? I was prepared to do anything. I didn't care what I had to go through, so long as I was well. And when I told Bruce that, and he sort of laughed and said, I think, we've got other alternatives we can start looking at. And he then started to speak to me about the trial.
A trial that a group of us here have initiated is our trial known as Prospect. It's really hoping to extend the tailoring of treatment, cutting the treatment to suit the individual. And it comes from the question of whether we can identify some patients who are adequately treated with surgery alone to the breast, rather than the standard approach where almost everyone is recommended to have radiotherapy after the surgery.
That appealed to me because we'd lost my husband and their father through the complications of cancer. His body just hadn't been able to withstand the side effects of radiotherapy and chemotherapy.
It was tough to find out Mum had been diagnosed, and having the no radiotherapy on the table for me was a big thing. Having gone through it with Dad when I was much younger, it was certainly a lot more comforting.
Radiotherapy it's an essential part of cancer treatment. If the treatment is having a definite benefit, then I would fully recommend it. However, if we can show that the treatment's not needed, then it would be very good to be able to spare a number of patients the need to go through it.
There are days when, most of the time now, I just forget that I've even had an operation. I'm really happy to be part of the trial because I think that this work is just so incredibly important. It offers a choice to hundreds of thousands of women worldwide that, why would you opt for invasive treatment if you can possibly do perfectly well without it?